Hi, I'm Dr. William Domb. I practice in Southern California. I'm a general dentist with a very busy cosmetic practice. And I've been using Dental Practice Optimizer for a number of years now. I think I was one of the first customers. And I have to say I really enjoy having that software backing me up, helping me understand how my practice is working day in and day out. When I came in this morning, I opened up my computer and there was an email from Dental Practice Optimizer, and I was able to go in and look at my practice in a total snapshot fashion. What's it doing now? How has it been doing over the last month and year? Also with that, there was a morning meeting presentation, so I know exactly what's going on for a given day. Does it make sense? Should we make some changes? How is it interacting with our overall plans for the month and year? SICA customizes the presentation that we get in the morning completely at our request. We tell them what we want to see and how we want to see it. Once we tell them it's set up, it comes automatically every morning, just as we'd like to see things. Here we're running Fee Schedule Optimizer, and this is another very interesting part of the SICAsoft system. Fee Schedule Optimizer gives us a very sophisticated look at the fees charged in our given area. They use a very smart algorithm to look at these things, and they have much better data, I think, than the commercial programs that are out there that you can buy. They really get detailed data, and I think it's probably a lot more accurate than what we get with some of the commercial programs. Also suggest you take a look at Hot Optimizer, and this is free right off of the SICAsoft website. It lets you get some of the fee schedule data by code number, fee schedule by fee schedule, and also some very interesting overall parameters like how is your hygiene department doing, hours or procedures or dollars per hour kinds of data. Ask the question, see what Hot Optimizer will tell you, and again, it's free. One other module of the system that we really enjoy is the practice valuation portion. If you're ever thinking about selling your practice, you'll realize that when someone is going to buy the practice, they ask you for all sorts of information, and it's a total pain in the behind to get them that data. It takes hours and drudgery to pull out all of the data and present it in a form that the potential buyer is looking. So with the DPO, we just tell it, do a practice evaluation, and we get all the data right out and can hand it to somebody at the drop of a hat. We tell them exactly what we want them to see, and it takes no work whatsoever to get the data to give to somebody. DPO is a very sophisticated system. By that I mean it not only looks at your practice management data, the conventional stuff like we're using PracticeWorks, some people use Dentrix or EagleSoft. DPO goes directly into that software and pulls out the data for that. But it also will look at your cash management software. For instance, if you use QuickBooks, it will integrate with your QuickBooks and be able to tell you all sorts of things about time and motion studies that will give you a much better handle on what's going on in your practice. And you may get some surprises once you actually look at that data where you think you're doing something that's potentially very profitable. It may not be when you look at the costs and time and disruption of your practice in order to do a particular procedure. So FSO will look at these things in a very smart way and tell us whether we're doing what we think we're doing. Training and installation are totally remote. Nobody has to come into your practice in order to do this. It's done transparently. You turn on your computer, they do the rest, and they tell you when they're done. Training is great. You sit at your workstation and you watch them operate the system from their office remotely, and you talk to them on the phone. They tell you what they're doing, and you can get up to speed on how to operate and get the most out of your system very, very quickly. But again, it takes very little to do that. The software is pretty self-explanatory, but it also has a great amount of depth and capability built into it. Keep in mind that if you have a consultant, DPO has a mechanism to send them your data at your request. They can specify what it is that they need to see. They will interpret all of the data. You don't have to do any of that. If you're not a data wonk, let the consultant do it entirely by themselves. If you want to know what's going on in your practice, DPO and FSO are invaluable. There may be times where you don't want to know what's going on in your practice. And in fact, with DPO and FSO, you don't have to look if you don't want to. But if you would like to have the optimum control over what things are going on in your practice and how you can improve your practice, DPO and FSO make a great deal